Good morning, class. Okay, we're going to continue with our review of the PowerPoint. So this is part 2 of chapter 4, and we finished in part 1 with a discussion of the connective tissue proper, and we started with the loose connective tissue. So we were looking at slides 73, 74, 75, and onward. Loose connective tissue proper, which means that there's a lot of space between the cells and the protein fibers. In other words, a lot of ground substance. So a lot of ground substance, which means there's space for sensory neurons, sensory receptors, blood vessels, lymphatic vessels, and other things, even glands, exocrine glands. And again, the main thing about this loose connective tissue is you can put things in between it. So we looked at areola, and we talked about areola with regard to being the support tissue underneath epithelium. So wherever there's epithelial cells, there's going to be then a basement membrane under that, and then there's going to be a loose areola underneath that. You can look at the colored boxes, the picture boxes, for more descriptions. Then we looked at adipose, and adipose is made up of adipocytes. Those are fat cells, and they can store triglyceride. Triglyceride is made from excess fatty acids that you consume and also excess carbohydrate. So that you can store fat in these special cells called adipocytes. More calories, more fat, bigger cells. Okay, now adipose is a good thing in that it surrounds organs, it protects organs, it cushions organs. It's found around the heart. It's found in the ventral body cavity on what we know as the omentum or the greater omentum and some of the other mesenteries. It's cushioning within the joints. So it plays an important role. Found underneath the skin in the hypodermis as an insulator, keeping heat in and cold out. So again, it's a good thing in the right amount. Obviously, too much fat can put stress on the heart, so on and so forth. That's adipose tissue, another loose connective tissue proper. And the third one would be reticular tissue. Reticular is made up of reticular protein fibers, hence its name. And the protein fibers, as I said, make a kind of a meshwork. They interlock with one another, forming a net, a mesh, a fishnet, and that becomes the soft tissue skeleton of the solid organs of our body. So solid organs such as liver, kidney, spleen, lymph nodes, bone marrow. And those organs are made by starting with the reticular tissue as the skeleton, and then adding the parenchymal cells, the functional cells, to that, and then surrounding it in a capsule. All right, so that's the review. I'm just going to skip forward. Like I said, in these videos, what are we doing? I have the PowerPoint up. I'm looking at the slides. I'm letting you know what slide I'm on as we go forward. So I just completed slide 73, 74, 75, 76, which talks about the white fat, brown fat that I mentioned in the last video. 77, 78, 79. So that brings us to slide 80. That's where the last video ended, slide 80. And that's dense connective tissue. So dense means lots of protein fibers, tightly packed, very little ground substance for strength, okay, for stability. And again, we gave examples of tendons and ligaments. So dense connective tissue, if you look at the slide, it says, is also known as collagenous or collagenous, right? Meaning a lot of collagen tissue, okay? Collagen has some stretch, but then reaches a point where it will tear. So it's very strong, has some flexibility, some elasticity, but of course not as much as elastic protein fibers. When you look at the dense connective tissue, they break it down into dense regular, dense irregular, and elastic. So let's just talk about elastic for a minute since I just mentioned it. Elastic simply means that there's going to be a lot of elastic fibers in addition to the collagen. So an elastic, dense connective tissue is going to be able to be stretched and returned to its normal shape without much damage. The others, dense, regular, dense, irregular, have less elastic, if any, more collagen. Regular, irregular, I'm sure you can guess what that means. Regular means all the collagen fibers are parallel to one another. Parallel. Dense, irregular, you have some going on an angle, forward, in and out, in every direction, in a somewhat haphazard direction of collagen fibers. Now, why the two differences? Well, if you think about a tendon or a ligament, not all, but many, when the tendon is stretched, it's basically pulled in one direction, all right? One direction of force, as they say. So all the collagen fibers are in that plane. So you get your maximum amount of strength. So that would be a dense regular. Dense irregular would be found where there's forces in all directions. So let's take your skin, all right? Your skin. You have your ability to pull it up, twist it, push it forward, back, side to side. You can put all different types of forces on your skin without it tearing because you have a dense, irregular pattern of connective tissue embedded in the skin, in the dermis of the skin. So different patterns for different functions. I mean, this has been the theme all throughout the body. The cells, the proteins, the structure, the arrangement is done so that a specific function is created throughout the body. And so we see these different types. So if you move on with your slides, I'm going to go to 81. It tells you about dense, regular connective tissue, tightly packed collagen fibers, and they give you examples. Tendons, ligaments, aponeuroses. Aponeurosis is a flat tendon. Instead of the tendon being ropey, somewhat like a rope, it's flat like a sheet of paper, like a thin sheet of paper. Okay? Tendons attach muscle to bone. Ligaments attach bone to bone. 82 is a nice picture box showing you an example of a tendon, a dense, regular connective tissue. 83 talks about dense, irregular, interwoven network of collagen fibers. And they talk about where you would find it, in the dermis of the skin, in some of the coverings of bone, like periosteum, in coverings of cartilage, perichondrium. And remember we talked about solid organs, reticular fibers, parenchymal cells, and then we wrap it in a capsule. The capsules of the organs are made up of a dense, irregular connective tissue to protect the organ. Then you get your nice picture box, 84, and it's showing you the dermis of the skin, and they're showing you in the lower level of the dermis, you're going to find a dense, irregular pattern. They finish with elastic tissue, and like we said, elastic tissue is a lot of elastic protein fibers in addition to the collagen. And they can be stretched and twisted without damage. And the example they give, the ligaments that hold the vertebrae together. We've looked at the vertebrae, we've looked at the spinal column, we've looked at the facet joints, and you have two inferior articular processes and two superior articular processes interlocking to form a facet joint. The vertebrae above, the vertebrae below. And that happens all the way up the length. So where the facet joints are, the ligaments that hold those facet joints together are elastic ligaments, elastic tissue, because the spine can bend and twist in all directions without damage to the ligaments. And they give you the picture box, and they show you the facet joints of the spine. So here they kind of sum up 87, telling you that connective tissues, all right, the ones we've talked about, some of them provide strength and stability, hold things in place, whether it be organs or cells, act as filler or space, where you can put blood vessels, lymphatics, nerves, sensory neurons, glands, and so on, like the areola. The last bit that they talk about in this family is something called fascia, and they introduce it here on 87. So fascia is very, very abundant Fascia is like a thin sheet of paper. Okay, like a thin sheet of paper that is found woven between many of the layers of cells in our body. So it is a connective tissue. It forms layers, it forms wrappings, it forms coverings around many of the tissue layers, many of the organs of the body. So let's go on. So on 88, they tell you that you can have a superficial, a deep, a subserous fascia. So they describe some terms. Let's move on. 89 is the picture you really want to look at, slide 89, because it's a picture of skin, muscle, bone. It's a section of the thoracic cavity that has been removed, and they're showing you the different layers of tissue. And what you see is that in between the layers of tissue, there is fascia. So if I'm looking at the picture and I'm describing it to you, and I start with the skin, okay, the first outermost layer in purple represents the epidermis, the stratified squamous epithelial cells of the epidermis. The pink represents the dermis, where we're going to find a loose areola, because it's always beneath epidermis, and then we're going to find a dense, irregular connective tissue beneath that, giving the skin its strength. The yellow is the hypodermis. That's fat tissue. Then you see a white line, and that is your first layer of fascia. Then you see some dark red, representing a layer of muscle. That's one of the muscles in that thoracic area, maybe one of the oblique muscles, abdominal obliques. Then you see another white line, another layer of fascia. Then you see the ribs. You see 3 ribs, and in between the ribs, more muscle tissue. Those are the intercostal muscles. And there are 2 layers, and in between those 2 layers, there'll be another layer of fascia. Then you come to another white line, another layer of fascia. And then that inner purple would be the lining of your body cavity. So we're in the ventral body cavity. We know it's a serous membrane. The serous membrane has 2 layers. It's a double membrane. The layer attached to the muscle and bone would be the parietal layer. And then we would have the organs. So what you see here is your layout of layers of cells and tissue. And in between each is a layer of fascia. So you can see fascia is quite abundant. It is between everything. It basically holds and weaves everything together. And another thought about fascia, when we talk about muscle tissue, you're going to see that muscle tissue is made up of muscle cells. Every muscle cell, so we're down to the cellular level, every muscle cell is wrapped in fascia. And then we take a bunch of muscle cells and we put them into a cluster of cells and we wrap it again in fascia. And then we take those bundles, fascicles, put them together and wrap it again in fascia. And every muscle is wrapped in fascia. That's a lot of fascia. So it's a connective tissue. It tends to be in thin sheets, wrapping and weaving its way between everything, and it holds everything together. And it's a major component of skin and muscle tissue. So that ends connective tissue proper. Connective tissue proper is a pretty big group with a bunch of different examples. One family, connective tissue proper. Next family, fluid connective tissue, slide number 90. And in this family, you have blood and you have lymph. And both of those are liquids. Why? Because the ground substance of blood and lymph is water. So, fluid connective tissue. Ground substance is a water base. The living cells, we're going to describe them, and the protein fibers that float throughout the water, suspended in the water. Blood and lymph, fluid connective tissues. So they start off talking about blood, and you have a chapter on blood later as we go through the course. In detail, you talk about blood. But what can we say about it? It's a fluid. It travels through vessels. It contains red blood cells, white blood cells, and platelets, and we've mentioned them before when we did our cell discussion. Red cells carrying oxygen, white cells carrying fighting infection, platelets doing clotting, hemostasis when you have a bleed. The proteins, there are different types, albumins, globulins, like immunoglobulins, fibrinogen, different proteins found in blood, and the plasma, the watery part, the ground substance. So the three components of connective tissue are there. They show you on slide 91 a picture of red blood cells and tell you what they do. A picture of 5 different white blood cells and tell you what they do. And again, as a review, we spoke about some of these cells the other day. When we're talking about healing and repair, acute inflammation, we talked about monocytes in the blood becoming macrophages. We talked about eosinophils and neutrophils as microphages. We talked about basophils as mast cells. So here are the 5 blood cells that we were referring to, and we talked a little bit about their role in the acute inflammation and healing of damaged tissue. 93 platelets. Platelets are for blood clotting. And that's really all they give you on blood. And like I said, we'll return to blood and we'll talk about blood in more detail at a later time. Lymph. Again, there's a whole chapter on lymph. So again, we're just introducing it. Another fluid connective tissue because it has living cells called lymphocytes. It has proteins, and it has ground substance, which is watery, called lymph, like a plasma. It also circulates through vessels in the body, and I refer to it as the sewer system because it collects up all excess fluid that develops in the body. It filters and cleanses it and plays a big role in immune function. And that's all we have on the fluid connective tissue. The last group is supporting connective tissue, right? Structural connective tissue. And there's only 2 in here, cartilage and bone. And again, bone is a big chapter on its own, and we go into the different details and components, and we have been talking about that in lab. The structure of bone, the lamellae, the lacunae, the osteocytes, the canaliculi, the central canal, and so on and so forth. All right? So we're going to do that in detail, but here they just are putting it into a category. It is a connective tissue. And cartilage. Cartilage is found on the end of most of your bones. Hyaline cartilage, one of the types of cartilage, is used to make up most of our joints of our body. It's structural. It's supportive. It allows for frictionless movement of the joints. And it also is somewhat of a solid. It's not as solid as bone, a little bit more rubbery, shall we say, but it's considered to be a solid supportive connective tissue because the ground substance is a solid. In bone, the ground substance is a solid. So they start off with cartilage, slide 95, and they tell you that cartilage provides shock absorption and protection. It's, like I said, part of your joint. It has a matrix made up of chondroitin sulfates, glucosamine sulfates, which are polysaccharides, and they form that gel or rubbery component of cartilage. Because cartilage is a solid, like bone, we have to literally scoop out a piece of the ground substance, meaning create a lacunae for the living cells to live in. And the living cells of cartilage are called chondrocytes. Chondrocytes live in lacunae within the matrix, within the ground substance of the cartilage. They talk about the fact that cartilage is avascular. No blood vessels woven within the cartilage, just like epithelial tissue. 2 tissues in the body that are avascular, cartilage and epithelial. They talk about the fact that cartilage has a protective covering over it called the perichondrium, like the periosteum that we talked about. Perichondrium, cartilage, periosteum, bone. And like the periosteum, the perichondrium offers protection, allows for growth and repair of damaged cartilage, just as we see in the bone. 97 says that there are 3 types of cartilage. Hyaline, the most common, elastic, and fibro. So let's work from bottom up. And they have picture boxes, right? So they say talk about hyaline, elastic, and fibro in the next couple slides, and then your first picture box on slide 100. Hyaline cartilage shows you a picture, shows you where it's located. Hyaline cartilage is most common. Hyaline cartilage is a very, very smooth, very firm type of cartilage. Creates a frictionless surface within your joints so that the joints move without any friction, without any encumbrance. All right? And they talk about elastic. They're showing a picture of a guy's ear. That the cartilage that makes up your ear is very flexible. My grandmother used to, right, pull my ear, twist it. Oh, you're so cute, you're a wonderful guy. And they have to say that, right? So my ear would go back to its normal shape most of the time because of the elastic cartilage. Because you can pull it and it returns to its normal shape. Elastic cartilage has a lot of elastic protein fibers, or what's known as elastin. And the last one, fibrocartilage, we've talked about, talking about the spinal column, the vertebral column. You know, you have vertebrae stacked one on top of the other. In between the bodies of the vertebrae is the big, thick chunk of fibrocartilage, very dense, very fibrous fibrocartilage, a lot of protein, a lot of collagen. Structural support, right? That's supporting the weight of your head, your arms, your torso. Big, thick chunk of cartilage known as the intervertebral disc, fibrocartilage. They talk about the growth of cartilage. I don't want to spend too much time on the growth of cartilage because we're going to talk about growth of bone in detail, and some of these terms, interstitial growth and appositional growth, is similar to what we see in the growth of bone. So we'll deal with these terms at a later time. So I'm basically skipping 103, 104, 105. Okay, but you know, if you look at those slides, at least you can see the lacunae with the chondrocytes in there. And like I said, you know, what you see in these pictures, the chondroblast, building cartilage, becoming a chondrocyte, which then maintains the cartilage, very similar to a discussion we're going to have in bone. So we'll save that discussion for bone. 106, bone. So with regard to bone, again, we're doing bone in detail in lab, and we're going to do bone in detail in chapter 6. They're talking about the different components of bone. The matrix being a calcified salt, very hard like cement. The osteocytes that live in the lacunae, the periosteum that covers it. 107 shows you a picture of an osteon, and we've talked in lab about osteons, a central canal with concentric lamellae, and on the concentric lamellae you find the lacunae. In the lacunae you find the osteocytes. Each osteocyte is interconnected to one another by a canaliculi, a microscopic channel, which ultimately connects to the central canal, where the blood vessels, the supply of blood, enters the osteon. All right, and there's many osteons packed together. There are interstitial lamellae. There are concentric lamellae. When we go to what we refer to as the bone model, the Swiss cheese model. All right? And that kind of ends the discussion on the support of connective tissues. And they finish the connective tissue chapter, or I say chapter, the section of chapter 4 known as connective tissue, with a discussion on membranes. So in lab, we scratched the surface with membranes. We had a lab exercise on membranes, exercise 12. We kind of were waiting for this moment to really get into the details because we needed to talk about what is epithelium, what is connective tissue. When you talk about those two tissues and put them together and make one structure out of it, that's the definition of a membrane. A membrane is when you have a layer of epithelium, a basement membrane, and a layer of connective tissue below it. Now that being said, you already know that if there's epithelium involved, the connective tissue layer beneath it is always a loose areola. And between those two is a chemical glue that I refer to as the basement membrane. So what is a tissue membrane? Not to be confused with a cell membrane, but a tissue membrane is when you put epithelium together with loose areola. And they go on to tell you that there are 4 types of membranes. Slide 109 lists them: mucous, serous, cutaneous, and synovial. All right, and they go on to describe them and give you pictures. What can I tell you about each? Let's start with the serous membrane, because that's the one we've been talking about most. The serous membrane is the double membrane, so it's 2 membranes. It's 2 tissue membranes, side by side. It's unique, unlike the others where they are single membranes. Serous membrane has 2 layers, and it's the membrane that lines your ventral body cavity and covers all the organs that are in it, okay? Having a parietal and visceral component. And we'll go into more details as we go through the organs. We'll be talking about that. The cutaneous membrane, we referred to that. That's your skin. All right, your skin is a stratified squamous epithelium, that's the epidermis, and beneath it, the dermis, has a loose areola connective tissue layer. Your skin is a cutaneous membrane because of its 2 components. Synovial membranes. Well, we haven't talked about joints and articulations yet, but 2 joints where 2 bones meet, okay? The joint, the inside surface of the joint, when we talk about a synovial joint, and it may not make complete sense now, but the inside surface of what's known as the joint capsule, meaning the ligaments that surround and hold these 2 bones together. The inner lining is called the synovial membrane. And we'll look at that in detail at a later time. And then finally, the mucous membrane. The mucous membrane, we've referred to it a little bit because we've talked about the goblet cell, the unicellular exocrine gland, embedded in the epithelium, producing mucus. Mucous membranes line the respiratory tract, the digestive tract, the urinary tract, and the reproductive tract, the lining. And mucous membranes produce copious amounts of mucus, which help to keep the outside world out from our inside world. And we'll see those as we go through. So there's 4 membrane types in the following slides. 110, talk about mucous membranes. And you notice in that slide that the loose areola connective tissue component of the membrane is called the lamina propria. It has its own name. Lamina propria is the name for the loose areola for the mucous membranes. We do not use lamina propria for the other membranes, just for the mucous membrane. They show you a beautiful picture, and in that picture on 111, you see the columnar epithelial cells, and you see a simple goblet cell. You see a unicellular goblet cell with producing some white mucus, exactly how you would find it in the body. And you can see the purple layer of cells, epithelium, and then the tan layer of areola. And that's consistent throughout all. They talk about the serous membrane, the serosa. They talk about the fact that it lines the abdominal pelvic cavity. On slide 113, they're telling you that the serosa that lines and covers your organs, digestive organs in the abdominal pelvic cavity, it's called peritoneum. The serosa, the serous membrane that lines and covers your lungs in the lung cavity, it's called the pleura. They tell you the serous membrane that covers and lines the cavity that the heart's in, pericardium. And they show you a picture. It's a simple squamous epithelium, very thin, very fragile. They talk about the cutaneous membrane, the skin, and the synovial membranes that line joints. And they give you a picture of the skin on 116, and they give you a picture of a joint and the lining of the joint on 117. You don't have to memorize all those different parts of the joint on 117 as of yet, because we're going to do joints in detail in a few chapters. So that is connective tissue. I'm going to end the video here and then we'll make a part 3 to follow.